Namaste viewers, welcome to the Facebook Live. Today's topic for our discussion is prostate gland enlargement. And for our discussion we have with us Dr. Vasanth Rao, MS Gold Medalist, MCH Urology, Consultant Urologist, Andrologist and Transplant Surgeon at Apollo Hospital, DRDO, Kanchanbagh, Hyderabad. So doctor, what is prostate?
Hi everyone, I'm Dr. Vasanth and I'm consultant urologist at Apollo DRDO. Now regarding this topic, prostatic enlargement and even the BPH, prostate is a gland of male reproductive system which is small in size and it is a shape of walnut present anterior to rectum at the base of the bladder, and it surrounds the urethra, which is a tube-like structure which is extending from bladder to the penis and carries the urine. So, prostate is mainly useful in the ejaculatory fluid and its diseases are common in elderly men.
So what are diseases affecting prostate?
The diseases affecting prostate are mainly by far it's a benign prostatic enlargement. Then we have prostatitis, which can be acute prostatitis or chronic prostatitis, and prostatic malignancy. In among these three, benign prostatic enlargement is by far the most common disease.
Then what is BPH?
BPH is a benign prostatic hyperplasia. It's a histological diagnosis. Actually, the term indicates that there is a proliferation of smooth muscles and the epithelial cells in the prostatic transition zone. And this is important in the fact that this growth of the prostate around the urethra causes obstruction symptoms and even irritative symptoms, so that it leads to obstructive LUTS and lower urinary tract symptoms.
What is prevalence of BPH?
Prevalence of BPH increases with age, and it's in around that is around 31 to 40 years it's around 8%, and around 50 to 60 years it's about 50%, and when the age increases up to 81 to 90 years it's around 90% is the prevalence.
So what are the symptoms of BPH?
Symptoms of BPH can be classified into two types. One is that there could be an obstructive symptoms. Another one is that there is irritative symptoms. Obstructive symptoms in the fact that there is intermittency, there is hesitancy, incomplete voiding, and post-void dribbling, poor flow. These are the symptoms of obstruction, whereas the irritative symptoms in the form of frequency, urgency, urge incontinence, so and nocturia. Nocturia is by far the most common initial symptom of the BPH.
So how is BPH is diagnosed?
Okay. BPH is diagnosed when the patient comes to the OPD. First and foremost, the history, what all I've told you before, the symptoms of the prostatic enlargement, whether it could be an obstructive one or it could be irritative one. So, detailed medical history is important. Next thing is the IPPS score, that is International Prostatic Symptom Score. Accordingly, the patients will be classified into mild, moderate, and severe types. Then we have the abdominal examination, then the DRE, digital rectal examination, neurological examination. Then this is being followed up by means of the preliminary investigations, wherein the urine analysis, and then if there is any evidence of infection, then we have the uroflowmetry, then the ultrasound regarding the prostatic size, and also any significant post-void residue which is present or not.
So how is BPH is diagnosed and how is BPH treated?
Treated, I've already told about the diagnosis. Diagnosis depends upon the history, then the examination, the basic investigations. Then we have the treatment. Treatment modalities are various options have been available. It all depends whether the patient have any bothersome symptoms or not. Bothersome symptoms and even the obstructive symptoms. Is there any obstructive or obstruction is there or not? If the patient has bothersome symptoms and obstruction, then surgery is indicated. And in either of the case where there is no obstruction or bothersome symptoms, then wait and watchful is useful. And in those who have only bothersome symptoms, medical management could be tried.
So what is the medical management of BPH?
Medical management of BPH varies from various drugs we have, where it could be alpha blockers. Alpha blockers are the ones which would block the overactive sympathetic muscles, which has been the smooth muscle, which is tone, sympathetic tone, which is increased in the prostatic gland, so that they will be helpful in the increase in the pressure, the flow rate of the urine. And then we have alpha adrenergic receptor 5 alpha reductase inhibitors, that is in the form of finasteride and dutasteride. This will be helpful in reducing the prostatic volume. So these are the main basic, either in combination or alone could be treated, alpha blockers. Then we have the mirabegron, beta 3 blockers would also be, agonist has also been useful.
So what is surgical treatment of BPH?
Surgical treatment of BPH varies. There are so many modalities of surgery have been available. The gold standard is the transurethral resection of prostate, which can be either a monopolar transurethral resection or it could be a bipolar. And then we have the various newer modalities in the form of laser enucleation of prostate, but the gold standard is the TURP.
Then what are the complications of BPH?
Complications of BPH varies. First and foremost, there could be a recurrent urinary tract infections. Second thing, there can be an obstructive uropathy, or it could be in the form of stone formation, could be there, or it could be an acute urinary retention. So these are all the complications. One, there could be a recurrent UTI. Second, there could be an acute urinary retention. There can be a stone formation and obstructive uropathy, so that it is going to cause the damage to the kidneys.
So thank you, doctor. Dear viewers, we have come to the end of our session and hope we have come and covered all the aspects. If you have further doubts, you can book an appointment with Dr. Vasanth Rao, either description and book an appointment. Thank you, doctor, for educating our audience in today's discussion. Thank you, audience, for listening to us. Stay tuned for more such educative sessions. Namaste.